Hey, welcome to your first Iowa Healthcare Association member video update. As the pace of change accelerates in our profession, the association is committed to exploring and deploying new ways to communicate with you in the channels and the ways in which are most effective for you. So this is the first of what we expect to be a series of periodic video updates over the course of the next year, and we'll get right into it. I'm going to be joined here in just a minute by Cindy Baddeloo, IHCA Senior Vice President and Chief Operating Officer, who's going to take us through sort of the second half of our presentation. This is about updating you on things related to the legislative session, regulatory updates, education updates, and a few other things as we move through this. So thanks for being with us. I want to get right into this as it relates to a legislative update given the date on the calendar. The 87th General Assembly of the Iowa Legislature gavelled in on January 8th, which means we're in the midst of our fourth week of legislative session. One of the first orders of business for the legislature this year is the passage of a de-appropriations bill, which is a fairly uncommon instrument, but it's a bill to balance the budget in the current fiscal year and find ways to balance the budget in a tight year. The governor has recommended cuts of about $19 million in de-appropriations. The Senate last week released its draft bill, which would cut more than $50 million. The House has yet to release its bill. The good news inside these de-appropriations bills is that Medicaid, both in the Senate and as expected in the House, is not touched. And so we don't expect the final bill, de-appropriations bill, to include a Medicaid cut, which is good news. As we move into the session, we start to talk about IHCA's top legislative priorities as the legislature gets on the other side of de-appropriations. Recovery of 90-day retroactive Medicaid eligibility is a top priority for the association. An exemption of chronic long-term care residents from the Iowa's Medicaid managed care system, which is something that you've heard the association talking about in recent months. Securing an inflationary increase for nursing, HCBS, and home health funding in this non-rebase year is critically important. And we're working to modernize the abuse and criminal background check process in Iowa, which has been a long-range association priority. With an eye on how significant the challenges that we face with the legislature are, the association has expanded our lobby team at the Capitol. We have brought on Cornerstone Government Affairs to join GovCom as our expanded IHCA lobby team at the Capitol. So a couple of new faces that you'll get to know. Matt Hinch with Cornerstone is a former chief of staff to Governor Branstad and Lieutenant Governor Reynolds. David Edelman is also with Cornerstone, is helping represent us. David has previous roles with the Democratic National Committee and the Iowa Department of Justice, among other things. And Sarah Allen is joining our team with Cornerstone. Sarah is a former lobbyist and staff attorney with the Iowa Hospital Association. They joined Susan Cameron and Kelly Myers on that IHCA lobbying team. Quick state of play. IHCA has met in recent weeks with the governor, every legislative leader, every appropriations chairman, and a number of other legislators to press our case for the correction and the recoupment of 90-day retroactive eligibility for nursing facilities in Iowa. There is, we feel, a broad consensus among the House, the Senate, and the governor that a mistake was made and should be corrected, particularly as it relates to our population. We are working to determine the appropriate vehicle to really correct that policy, but know that this is a top priority, and we are working to recover this not later than this legislative session. And we feel good about where we are. We still have a lot of work to do, and please be available to the association and to your legislators to answer questions as we move through this process. We also continue to push for an exemption of chronic long-term care, the chronic long-term care population from Medicaid managed care. We believe that this proposal, that this action, which would generate more than $16 million in savings, which is inside the current budget year, in a very tight budget year. We know how important it is to find money that's already in the budget. We would suggest using that $16 million or more in savings to help address chronic long-term care funding for nursing, HCBS, and home health providers. This is a very challenging environment to be pushing such a change. We recognize that, but we know how important it is, and we continue to make our case. It's just as critical, and we continue to make our case just as aggressively to secure inflationary increases for nursing, HCBS, and home health. This in this non-rebase year. We know that this is not a rebase year, but given the condition of the profession, the funding challenges that we face, chronic lack of funding across the spectrum, we know that we have a case to make to legislators and the governor that we need funding inside this current budget year, and we're pushing very hard for that. We will be releasing our budget requests, our numbers that we'll be requesting here next week, so be on the lookout for that. And also please be on the lookout for a request to contact your legislators. We will have some information and some guidance for you in terms of what we'd like for you to communicate to legislators. Quick regulatory update. We're working with the Department of Public Safety to explore a tiered system which would create an opportunity for providers to pay an additional fee to be moved up in line to get their check done within 48 hours. Know that this would be not a requirement, but an option. We would suggest that any additional revenue that is generated through this process is used to grow and reinforce the SING system so that we have more capabilities and checks ultimately can turn around quicker. Modernizing the background system is a monster of a priority. We're taking this in pieces. We do have a survey out now about your interest in participating in such a system. I'd encourage you to please fill out that survey. On the IHCA front, we've been very active in working with DIA on new interpretations that they have taken related to dual perimeter alarm requirements in assisted livings. We have expressed our significant concern about the impact, the negative impact on culture within a number of assisted living facilities that such a interpretation would create. The good news is the department has agreed to freeze enforcement of this new interpretation until we can hopefully sort this out. We have presented what we believe to be a very practical, very workable solution to this to the department, which they are currently reviewing. And so stay tuned on that, but we have been in regular contact with the department working to solve this dual perimeter alarm issue. On the home health front, we continue to seek relief from CMS on matters relating to nurse aid competency. We have conducted that statewide survey that a number of our home health providers saw recently. And NOC is meeting with CMS very soon, and they are armed with our recommendations to resolve that issue. And so, again, stay tuned for more on that. We feel good about where we are there. Some good news, and I'll hand this off to Cindy. New interpretations at CMS, we believe, have begun to bear some fruit in Iowa as it relates to finding activity. We have begun to see some declines very recently, particularly in the most recent quarter, in per diem finding activity. We're seeing quite a bit less per diem and more per instance, which in aggregate ultimately ends up being a much smaller figure. So we are encouraged. We are not satisfied by any means, but we are encouraged by the trend here, and we'll continue to keep you updated as we move through these changes. But we have been encouraged, and it's something that is encouraging to us. So with that, I'm going to hand this off to Cindy Baddeloo, Senior Vice President, Chief Operating Officer, to take us through the rest of the video. Thanks.
Thank you, Brent. What I want to talk about is give you an update on the nursing home and the home health rebase that's being finalized back for July 1st. The updated nursing home rebase rates were released online this week, and there should be a letter coming out by DHS to each of our nursing facilities across the state. As well as for home health, we had a very positive recalculation of the LUPA rates last week. So the new rate schedule was sent out to the home health agencies last week, and that should be also being online by DHS with an updated informational letter coming out to you shortly. I wanted just to give you an update on education and programming available in the next just 6 weeks. We have education conferences coming up that are across all the disciplines. Starting next week with our district education, we're having DHS come out and talk about Medicaid applications, guardianships, conservatorships. So if you haven't signed up for that one, that starts actually already next week. We have specialized education for your dementia practitioners. If you have a memory unit, this is an important one to look at. Fall prevention workshop for creating a safer environment. If you have healthcare professionals working on strategies in that, whether you're in a nursing facility, assisted living, or home health agency. And then as well, we have 2 leadership programs. One is a conference, our Workforce Symposium, new this year, focuses on hiring and retention strategies for our approaching your workforce plan. And then we have our long-term care nursing and administrator leadership program coming up. For our nursing facilities, we have some specialized education just for you on MDS 3.0, the new requirements of participation phase 2 survey update, and then also the certified dietary manager workshop, all new ones that are also extremely important. And then our annual ones are our life and fire safety coming up the end of February, and as well as our spring conference is the end of March, but that information is just coming out this week and has a track for all of our members in that. From a communication standpoint, I think you should have saw and already are receiving, we are doing a legislative update that comes to your email every Monday, as well as our IHCA bulletin that comes every Wednesday. So if you're not seeing those, make sure you let us know so those that you are getting that up-to-date information. As always, if you have any questions or need more information, please call or email our number, 800-422-3106. And email is just IHCA@iowahealthcare.org. And just want to say thanks for everything you all do and listening to our video first conference. Thank you.